Yeah, sorry.
Okay.
I thought we had it though. Okay. I'm Erica Howard, and I am going to perform an assessment on Mr. Watson today. It's the HEENT assessment. So, Mr. Howard, is it okay? Mr. Watson, is it okay if I perform this assessment today?
Yes.
All right. So we'll begin this assessment by inspecting his skull and his scalp and his hair. So we will check his scalp and his skull for any mass, any discolorations, any lesions. I'll look at his hair to see, look at the distribution of his hair. The color of his hair, is it soft, is it hard, is it brittle, oily, or dry? And just kind of look at the shape of his head. That's an important thing to kind of look at. See if it's round, normally shaped. I also asked him to smile and look at the symmetry of his smile in his face. So, all right. So next I will move to Mr. Watson's nose. When I'm looking at Mr. Watson's nose, I will look at his septum just to make sure that it's straight in midline. Trying to see if there's any deviation from side to side. I'm also going to look inside of his nose just to check and see, look at his, look at the turbulence in his nose. You're able to see the middle and the inferior. You cannot see the superior. Should be pink and moist, so that's what we're looking for. All right, Mr. Watson. So I'll check his nose. And this light isn't working, but you just want to make sure that it's moist. And moist and pink when you look in there. So what we'll do, we'll move from his nose to his mouth. When we look at his mouth, we're going to check his gums, his teeth, look for any cavities. We'll look in the upper and the roof and the floor of his mouth. See if you see any lesions, any discolorations, any white patches or sores in his mouth. And we'll also check his tonsils when we look back there. So, right, Mr. Watson?
Mm-hmm.
All right. Got a light. And if you open up, I'm just checking the inside of his mouth, looking at this, looking at the top. Lift your tongue. Look under there. Good. And I'm gonna use the tongue blade to check. So you just kind of want to make sure it's pink and moist and not dry. You don't see any other abnormalities. You also can look for cavities and things like that when you're looking in his mouth. So we'll move from his mouth to his ears. So when you're checking the ears, you want to start by palpating. You palpate the auricle of the ear as well as the mastoid of his ear. And you're checking for tenderness. And you do both sides, palpate. And you're also looking to see if you see any sores, mass. Make sure they're symmetrical, round, no discoloration, no drainage that's obviously coming out. And one of the tests that we do on the ears is the tug test. So you tug along the auricle and you ask him if he feels any tenderness. He'll let you know. Any tenderness, Mr.
No. No.
All right, good. And I would go to the other side. And one thing, you do have tenderness, especially to the auricle. Sometimes he's saying no. Sorry.
No.
And when you're checking the auricles, if he has tenderness to his auricles, that could actually mean otitis externa. If he has tenderness here, the mastoid region, it could be otitis medius. So next I will get my otoscope and do a visual inspection of the inner ear. When we're checking the inner ear, you want to make sure that the eardrum is intact, that it's a gray color, and you're also looking to see if it's shiny or dull. While you're looking at his ear, make sure you're looking to see the skin in the canal. If it's red, if you see drainage. Of course, they're going to have some wax, but is it impacted with wax? Those are some of the things you want to check when you're looking at the ear. Because he's an adult, you pull up and back. I don't know why I feel funny. All right. You're also looking for the cone of light right ear, 5 o'clock. Left ear, it'll be at 7 o'clock. Same thing on this side, up and back. All right. Important thing, just making sure that eardrum is intact. All right. So let's move from his ears to his tracheal and neck region, his neck region. So we'll kind of do the same thing like we did in the other areas. We'll check for symmetry. Look, see if we see any obvious mass, any obvious lesions or discolorations to his neck. And the first type of palpation we will do, we will palpate here. It's trachea. Start with your finger here, and you work your way up. So you kind of walk your way up there, and just palpate it. Is it even? Does it feel enlarged? Start there and check his thyroid. So next palpation will be done for the back. The easiest way to do this is to ask your patient to turn his head to the side and look downward, and you palpate. Don't choke your patient, just palpate lightly. And you're just checking for enlargements. And Mr. Watson has done this, so he already turned. All right, do this. Okay. All right, so I think that would conclude our neck assessment for Mr. Watson, and we'll move to the back. So, posterior region. So the posterior region will do kind of like what we did in the other regions. We'll start by inspecting, then we will percuss and palpate, and we'll also listen. So we'll start by looking, see if does it look symmetrical. Do we see any lesions? Do we see any obvious abnormalities? Anything that'll make us think he may have scoliosis or something like that. So we start by looking for things like that. I don't know any on Mr. Watson. And then next I'll palpate. So I'll start right on this. And what I should have asked Mr. Watson to do would be to tell me if he feels tenderness. So, Mr. Watson, any tenderness when I palpate?
No, 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 no.
Okay, so he has no tenderness during that palpation. Another thing that I would do for Mr. Watson would be to check his respiratory expansion. So I put my hands on his 10th intercostal rib and ask him to breathe in and out. And I'll just look to see if my hands move symmetrically, if they move even. So, ready, Mr. Watson?
Mm-hmm.
All right. Wait, Mr. Watson. All right, ready. Again. One more time. All right. So next, what I'll do for Mr. Watson is percussion. And what we'll do with percussion is we will use our finger and tap our finger and listen to the sounds. Renaissance means that it's normal. If you hear a dull sound, that could actually be consolidation and could require some attention. And if we were to hear hyperrenaissance, there could be a fluid-filled area or an area where it could actually mean that a person could have COPD or emphysema. So we'll do all areas just like we did before. Start here. And another test we need to do in the posterior area is to test the CVS region over his kidneys, just to see if he has any tenderness. So we'll start by placing our hand here. And any tenderness?
No.
Right here?
No.
No tenderness. So the next exam that we would do for him would be tactile firmness. And that's when I will place my hands on his back and ask him to say 99. And you're listening and you're feeling at the same time. If it's even, symmetrical on both sides, Ready, Mr. Watson?
Mm-hmm.
When you feel my hands move, just say 99.
99, 99, 99, 99, 99.
Okay. So next, what I'll do is I'll ask you a tip for long sounds. Same thing applies from when we were doing percussion. You're listening to those sounds. You're listening to see if you hear any adventitious sounds, any wheezing, any rails, any bronchi. Those are the things you're listening to when you're listening to his back. We're listening to his lungs. So, ready, Mr. Watson?
Mm-hmm.
Every time you feel me move, just take a deep breath in and out. Take your time. It's no rush. Ready? All right. So there's also two other actually speaking tests that you can do from the posterior area. One is epiphany, is when you can have the patient to say E, and you're listening to hear if you hear him saying E, or if you're hearing him say A, which is AY. If you hear AY, that's an abnormality. Another test you can do is bronchoephony, and if you have and whisper, and what they say 1, 2, 3, or they say 99. And if you can hear that loud and clear, that means there's consolidation and there is reason for concern. So we'll do the ephony test. I'm only gonna demonstrate one of them. All right, and we'll do just like we did before. Oh, I'm sorry. I'm sorry, Mr. Watson. Will you please say E when you feel me move?
E. Oh, okay.
I'm sorry.
Okay.
I'm sorry. Sorry about that. All right. Ready?
E. 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 E.
All right. Very good. So we're gonna move back to the anterior chest area. Before we start the anterior test, there is one thing that I forgot on the nose, which was to check for patency of his nostrils. So what I have Mr. Watson to do is I'll have him to occlude one nostril and breathe in and out. Good. And I'll have him to do the other side. Good. And that's to check for patency, make sure he doesn't have any obstructions in his nostrils. So now we're going to do the anterior chest. So the first thing we do when we get to the anterior, kind of like the posterior, we kind of look at the symmetry of it, look at the shape, kind of see if you see any lesions, any mass, any look for signs of broken ribs, maybe any intercostal deformities. So that's one thing you look for. And you also, while I'm talking, I'll be checking his respiratory rate. And is it within normal limits? If it's now I would think that his is between 14 and 16 because I was kind of watching him and watching my watch at the same time. So you want to just make sure that he's having even chest rises and that a normal respiratory rate. So we'll do just like we did in the posterior. We'll palpate and we'll percuss and do a few other tests. So, ready, Mr. Watson?
Yes.
So I'll first check, palpate him to see if he has any tenderness at all. Ready, Mr. Watson?
Mm-hmm.
Any tenderness?
No.
Tenderness?
No. 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 No.
Okay. So he had no tenderness. We'll also do respiratory expansion in the front, just like we did at the back. I'll put my arms around him, ask him to breathe in and out, and we'll see how if my hands rise and fall evenly. Ready?
Mm-hmm.
Deep breath. Mm-hmm. One more time. Good. Good. So, just like we did in the back, we'll do in the front. We'll do the tactile firmness test, where we touch and you ask them to say 99. So, ready, Mr. Watson?
Ready.
We're gonna do the same thing we did in the.
Na 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 na.
Okay. So, and the next thing we would do for Mr. Watson, I'm thinking is auscultate. I think that's what's next. So,
You did start right.
not yet. I'm about to do it. I'm about to auscultate. So, that's what we'll do next. I'll auscultate. So, first we'll start by auscultating in here. And this can only be heard in the front. It can't be heard in the back. So you always want to do the front. And then next I will auscultate all areas of his chest. No. First I'll percuss. I haven't percussed yet. I knew it was something I was forgetting. So we'll percuss. And I'll do it just like we did in the back. We'll check it's the same way. So I also hit my finger and do the percussion test. Same thing applies. If you hear a dull sound, that can mean that we're over an organ. A flat sound can mean we're over a bone. And reticence means that it's normal. All right. So it's kind of like the same thing that we did posteriorly. Ready, Mr. Watson?
Mm-hmm.
Hold your arm up just a little bit. I think this is okay. All right. So we perform our percussion test. So next, what I'll do, I'll auscultate, and that'll be the last part that I'll do for him. And we'll do just like we did in the back. All right, deep breath. Good. All right, and I think that completes our assessment. If you'll do a 360 of the room and give me a time count, that'd be great. Thanks, Mr. Watson.
You're welcome.
You're the best.